Meeting called to order.
I request President Rotarian Hemlata Bhandari ji to please confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated on the group, and I hope everyone has read it. And since no queries and questions were raised on the same, the minutes of the previous meeting stands confirmed.
Thank you, President. नमस्कार और आप सभी का रोटरी क्लब ऑफ ऑर्गन डोनेशन इंटरनेशनल की आज की मीटिंग में बहुत बहुत स्वागत है। आज का टॉपिक है रिवर्सिंग लिवर फेलियर और आज के हमारे गेस्ट हमारे अपने क्लब के रोटेरियन डॉक्टर रमेन गोयल, जो एक सुप्रसिद्ध प्रख्यात डॉक्टर है मुंबई के, FRCS MS President, Diabetes Surgery Foundation, Director, Center of Excellence in Diabetes and Bariatrics, Wockhardt Hospitals, PD Hinduja Hospitals, Mumbai. और मैं अनुरोध करूंगी डॉक्टर मोनिस PHF Rotarian PHF Dr. Rohan Monis से to introduce the guest today.
Good evening, everybody. Good evening, Rotarians, and good evening, Dr. Ramen Goelji. Well, it's a pleasure for me to introduce Rotarian Dr. Ramen Goel. He's a pioneer in diabetes and a bariatric surgeon from Mumbai. He's presently the director of the Center of Excellence in Bariatric and Metabolic Surgery at the Wockhardt Hospital at Mumbai. I'm pleased to say his areas of expertise is a huge list of things, but to make it very simple, his areas of expertise is bariatric and metabolic surgeries, comprehensive obesity and metabolic disorder management, weight loss surgeries, endoscopic sleeve gastroplasty, gastric swallow balloon, and the revisional bariatric surgeries. The founder-president of Diabetes Surgery Foundation. He's also a member of the Specialist Board for the National Board of Examinations in the Government of India. He is the founder editor of the Journal of Bariatric Surgeries and has over 40 research papers and chapters to his credit. He's the past president and now the chief trustee of amazing organizations. A few of them to note are Indian Association of Gastrointestinal Endosurgeons and also All India Association for Advancing Research in Obesity. And a surgeon, teacher, researcher, and has amazing and significant contributions into advancing bariatric and metabolic surgery in India and across the globe. Welcome to you, Dr. Ramen Goelji, for this forum. You can take it forward from here.
Thank you, Dr. Monis. Thank you so much. You know, being a part of this club, I have been watching various programs. And when I was asked to speak on this topic, I thought all of you know much more about liver than what I'm going to talk to you today, because you've heard so many specialists, liver specialists talking about it. I'm basically a metabolic surgeon. So I was wondering what, and probably that's why this took the maximum time for my preparation of my presentation than what I normally do, because suddenly I realized that I'm going to talk to experts about a topic which is actually very relevant, because we are talking of organ transplantation. But an important component of that is that can we reduce the requirement of organ transplantation? So, Madam President, I'm not making our club redundant. I'm just saying, in the interest of humanity, can we reduce the pressure of transplantation over a period of years? And so I'll start my presentation, and hopefully this should work. Are you able to see the slides?
Yes.
Yeah. All right. So we all know that organ transplantation is required when the organ fails, and we are talking of liver failure today. Are there opportunities that we can limit that failure? And there have been some new developments and some older information. So I'm going to club all of that together and we'll try to show you. So first thing is that liver is a very, very tough organ, it works round the clock, just like our heart or lungs or kidneys. And it's just one. So whether it's heart, whether it's brain, or whether it's liver, it's just one organ. And it has role in everything, practically everything. Brain has a role in controlling our functions, but this has a metabolic role on many things, as you can see. And that is why the liver is considered as such a vital organ by everyone. Now, surprisingly, as I was looking for it, this is a very recent study published in 2025 from India, which from Dr. V. Mohan and group. And what they have done is they have collected data from dietologists and endocrinologists across the country. And they have found that in their patients, almost 68% of them have advanced liver disease, not fatty liver, it's an inflammatory liver disease. And almost 34% of them already have fibrosis. So if there are about 40 members attending this meeting, you can expect about 25 odd to have a advanced fatty liver, and almost about, if it's 33%, so almost about 10 of us maybe having fibrosis. It's a very scary thing, because these are diseases which were always considered a one-way street. Once you develop inflammatory disease, it's just a matter of time that it progresses into fibrosis, and then over a period of time it progresses into cirrhosis, and then maybe a liver cancer or other issues that I'm going to discuss. So this is a fact that we have one of the highest burdens of liver disease, if 65% of the population, adult population. So we are looking at almost about 2 crore adult Indians who have chronic liver disease. And what's scary about the cirrhosis is that once a person gets admitted in an ICU, as long as patient doesn't go into ICU is a different thing. But once the patient goes in ICU with cirrhosis, almost 50 to 60% of them die within 3 months. Now, this is much worse than having a COVID or many other diseases. And I am sure organ transplantation, Rotary Club has discussed it again and again, that 2 lakh Indians are dying annually from cirrhosis because they don't get the organ on time. So it's a very significant number, and this is the documented. Maybe there may be more. And that's why we need to think that as the Rotary Club works to get more transplantation in place, we simultaneously should emphasize liver health, which is basically a medical issue, but there is a lot of ignorance about that in the medical community as well. And so why are these liver diseases increasing? We all know that obesity is rapidly increasing, diabetes, processed food, higher alcohol consumption, we are not physically active, and also because we are living longer. So if earlier the lifespan was 56 years, now it's around, in a middle class and upper, it's above 80 years. So obviously the old age diseases will manifest more, and this is one of the reasons why liver diseases are increasing. And it's a very quiet and unnoticed problem. As I'm saying, 70% are likely to have fatty liver. Then it goes into inflammation. Again, there are no symptoms, no signs at that time. If there are no symptoms, you don't go to a doctor. If you don't go to a doctor can't find a sign. So, and then gradually fibrosis happens, and this is the time when some symptoms start coming. And the alarming symptoms come when you have cirrhosis. And when you have cirrhosis, it happens over years. And my topic of the day is, this can be interrupted. And this is what I'm going to talk to you in next 10 to 15 minutes. And as I said, that early on, it feels completely normal. You may be having alcohol every day and still you have normal liver enzymes, or you have no symptoms related to liver problem. But when it happens at a later when you start having jaundice, when you are mentally confused, or if you are bleeding through the food pipe or along the stools, or there is a weakness, the muscle wasting happens, then by the time it's too late. So, fatigue is something that you are feeling tired. Now, tiredness is a very common problem that everybody believes happens for so many reasons. I did not eat well, I have not slept well, but it can also be a symptom of a liver disease. So I think it's a good idea that we screen those who are at risk, and who are at this risk are these people. We have already pointed out, if you are suffering from obesity, diabetes, if you are having alcohol on a regular basis, if you are a senior citizen, or if you are sedentary in your activities. So a brief 2-3 slides about how fatty liver goes to liver failure and what is the possibility of reversal. So first thing is that we have more fat in the liver. That means we have more triglycerides in the liver, and that leads to increased inflammation, fibrosis, and cirrhosis. Now, it's not only about liver. When this happens, it increases chances of malignancies. Increases chances of deaths, all cause deaths, not only liver related deaths. It increases chances of heart attacks and brain strokes. And this is what is given here, that the possibility of how much the possibility of death goes up related to liver problem when you have these kind of liver diseases. So because liver is a master gland for so many metabolic functions, so if that is not working, it affects various other organs of the body, and somebody may have a heart attack and dies, and even though it was a liver cirrhosis which was the precipitating cause. So can we prevent liver transplant? Can we make Rotary Club organ transplant redundant? Not really, but sometime yes. So the best transplant is one that never becomes necessary. Can we avoid a transplant at all? So let's go ahead. So what has happened with research going in many fields all over the world? Parallel research is going on. Parallel research in nutrition, parallel research in medicines, and parallel research in metabolic surgeries, and their outcomes are coming ahead, and we can combine them to see whether we can avoid a transplant. So these are the guidelines of various international organizations like American Diabetes Association or endocrine societies. So what they say is that you should have a healthy lifestyle. So if you have to lose weight, control your diabetes, reduce your heart risk factors like smoking or alcohol or other issues, and then maybe if bariatric surgery is required. Then those who are having fibrosis, then you may need medicines. Now, who are the people who need medicines? Those who have fibrosis or who have inflammation in the liver. Now, there is a very interesting medicine, resmetirom, which has been approved by FDA but not yet approved in India. So it's not available in India, but this medicine, whenever it will get approved, is specific for liver fibrosis. This is not like the semaglutide that I mentioned next, which is approved. But resmetirom works only on liver fibrosis, and it does not cause weight loss. So I'm not talking much about it because we do not have first-hand information about it, but it is available in US and will be probably a game changer in liver disease as it will get approved. There are clinical trials happening in India under CDSCO, and if that happens, and the target population is obviously those who have obesity, who have diabetes, and who have lipid abnormalities like raised triglycerides or high LDL. But even though I'm going to talk to you about medicine and about bariatric surgery, please remember that whatever we talk, lifestyle is the bottom line, because we need to eat healthy, we need to walk regularly, we need to do some kind of strength training regularly, have a good sleep, keep our anger under control, and avoid alcohol. because each of these things cause major changes in the liver. So we need to remember this irrespective of whether you had a bariatric surgery or whether you are going to go take one of these medicines. And we also know that every kilogram counts. So it's not that I must lose 50 kgs or 20 kgs to have any benefit. Even 10%, 10 to 15% weight loss. So if somebody is 100 kgs and loses 10 kgs, it's great because that can help them improve their fibrosis. And so probably weight loss is one of the most powerful medicines for liver, besides diabetes control. Now, the medicine that's making news and that's approved in India is semaglutide. It's a new chapter in liver cure because the Indian regulatory authorities very recently, and that's why this topic came through, just about 10 days back, approved its use for liver diseases in India. And the brand that has been approved, this is the only brand which is approved yet, and the semaglutide has been approved for liver disease. So we'll briefly talk about that. How does this semaglutide help out? This is the chemical is GLP-1. It reduces hunger, it reduces calorie intake, it leads to weight loss, it reduces fat in the liver, it reduces insulin resistance, it reduces inflammation. So all this leads to better liver functions and possible improvement in fibrosis. Now, what you will realize is this is not about weight loss. It improves many other metabolic functions, metabolic parameters, and that's why the the this medicine is a metabolic medicine. That's why it works so well, and that's why it got approval for liver disease in India so early. Now, how does this work? So it works at various centers. It works in brain, in hypothalamic receptors. So from there it reduces your hunger and cravings. So person before a meal is less hungry and also has less cravings for, let's say, sweets or alcohol or smoking. All that has been seen in various places. Then it slows down gastric emptying. So then you are feeling full after a meal. So on one side you are less hungry. So you are having, instead of 4 or 5 meals a day, you are probably having 2 meals a day. You are eating more healthy because you have less of cravings. And then you are feeling full for a longer duration after you take this. And then it helps in diabetes control by releasing more insulin from pancreas. As I mentioned, it reduces insulin resistance. So the insulin that is reduced works better. And it also suppresses release of stored glucose. So liver is a storehouse of glucose. And so it works on a glucagon hormone, and so the less glucose is released. So all that together helps in diabetes control and in weight loss in these patients. Now, it has also been seen that this is not driven by weight loss alone. The studies have shown that even though people who hardly lost any weight, they had much better liver parameters because they were given this medicine. So that's why this is now a situation where we can give these medicines even a normal weight person with the liver disease, and they can have the same benefit compared to somebody who is 20 kg overweight or 30 kg. So these medicines basically came initially for diabetes, and then we started talking that we can use them for weight loss, and now we are saying forget the weight loss. Even if somebody is normal weight and has a liver disease, we can use them to improve their liver, and this is how it has gotten approval. So I think this is a good option, and we must remember this because this works both ways. It works for liver improvement. It also works for other parameters. So in the upper line, what you see above that arrow, it reduces weight. It improves lipid profiles. it improves diabetes, and it improves cardiovascular parameters. And on the bottom side, it helps in MASH resolution, disease activity, it halts fibrosis, and it improves fibrosis. So altogether, it helps in a completely in improving the health of a person, and to probably provide them a longer life compared to somebody who was. So up till now, once somebody has a liver disease, we used to think that we were passive observers. We will only give a supportive treatment. There was no definite treatment. But with the introduction of these two molecules, one available in India, one not available in India, and what I'm going to talk to you about a bit about bariatric surgery, there is a possibility that we can reverse the progression of the disease. We need not be a passive observer. So what are the results that have been seen in various studies? It has been seen that patients with advanced fibrosis, okay, these are not the ones who have started bleeding or who have fluid in their or ascites, but patients who have the F1, F2 fibrosis. There's a 37% improvement in liver fibrosis and 63% achieve MASH resolution. That means those who have inflammation. We are not talking of fatty liver, we are talking of those who have inflammation. It's a very significant, these are very significant results. And this is why these medicines are given such fast approval for a disease for which there is hardly anything available on the allopathic side. But please remember, these medicines are powerful, but they are not magic. If the medicines have to be taken lifelong, and they have to be clubbed with long-term healthy habits and lifestyle. So it's like a three-legged stool. So if you are thinking you are taking medicine and doing unhealthy lifestyle, it's not going to give you the kind of result that is expected, that's possible. So now the medicines have brought focus on the job that I have been doing, bariatric and metabolic surgery. We have been doing this for almost 25 years, 26 years. And now suddenly there is a increased number of patients who are looking at metabolic surgery as an option for various reasons. And they are looking at the results because they work the same way. They work on metabolic. They trigger the hormones, not only the GLP-1, it triggers GIP, PYY, amylin, multiple hormones, and has a similar or even better. So what happens after these surgeries? Just about 3 slides. We have weight loss almost to the tune of 80 to 92%, and diabetes resolution. That means they go off medicines in almost 65%, even 5 years after we do the surgery. These are our own results published in various international journals. And this is a very important study where before and after bariatric surgery, they did liver biopsies. And they found that there is a 90% patients had improvement in fatty liver, 80% had improvement in inflammation, and 65% had improvement in fibrosis and early cirrhosis. So significant benefits which were known, but because this is a surgery, so people were not talking much about it. But now with the medicines there and large awareness created by a pharmaceutical company all over the world, suddenly people are finding that they can think of surgery as an option. And so how do we manage these patients? So if patient as a child is cirrhosis, we can directly offer a bariatric surgery. But if they have a decompensated cirrhosis, so for those who are not doctors in the group, decompensated cirrhosis is when the liver has given up, and then the fluid starts collecting in the abdomen, or they start having bleeding from the food pipe or through the anus. Then they cannot be offered a surgery. They are not good candidate. Then they are probably the only option for them is liver transplant. So till this stage, surgery can be done, or maybe medicine can be offered. So what should be done? What should be offered? So I think GLP-1 gives very good weight loss. It's reversible. There is no surgery involved. It's excellent for many patients. And it's good, but only challenges it's one has to take lifelong medicines. And it's good for people who are 27 BMI. At the moment, it's advised for 27 BMI and above, while surgeries are only possible above 35 BMI. So I think these are two different sets of patients. Those who are 15, 20 kg overweight and have liver disease are excellent candidates for semaglutide. Or those who are 25, 30 kg or more overweight and have a liver disease are excellent candidates for the surgery. So there are different set of patients, and that's why we say that both of them are treatment for metabolic diseases and not simply obesity. They improve liver fat, liver inflammation, and in many patients, fibrosis. It's very difficult to identify which will be the patient who will improve, but since there are no other options available as yet, this is probably the only choice. And we need to have appropriate patient selection. They are complementary to each other. They are not competing approach. And it's always preferable to halt progress of liver failure than to go for a transplant. Transplant is not an easy surgery. I'm sure you so many times you people have discussed this with transplant surgeons, the struggles. Patients really struggle. It's a tough surgery, not about the cost, but the recovery. But the main question is, can cirrhosis really be reversed? So I think it depends on what was the cause of liver disease. What is the stage of cirrhosis when we are discussing this? What is the time of diagnosis and treatment, and have we been able to remove the cause of the ongoing injury? So these are the factors that we discuss, because we have seen that improvement happens, but saying that everything will become completely normal is extremely uncommon. So maybe the transplant can be avoided. Maybe the further progression of disease can be stopped, and they can lead a healthier life. But saying that everything, the scarring, the fibrosis will go away, is not a realistic situation. But even if we can avoid liver failure, ICU admissions, bleedings, ascites, and transplant, it's a great achievement. And a lot of this comes because of these two new medicines which got FDA approved. Now, who has the better chance? Those who are diagnosed early. So it's not a question of that's what I started with, that symptoms come late. So early diagnosis saves life, and it's important because, as you can see, that the results are better if somebody stops alcohol, if diabetes is well controlled, if they are having good nutrition and appropriate treatment. It could be a medicine, surgery, or just a lifestyle change. If we know the main cause was alcohol and alcohol is withdrawn, maybe they will not need medicines or surgery at all. So all these things. But once they start bleeding, once they have a severe ascites, means fluid in the abdomen, or they have a liver cancer, which happens after cirrhosis in some patients, or they have encephalopathy, that it affects their brain, then none of these interventions are likely to help. So what treatment helps? I think the entire liver care working together. There is no single miracle therapy. Lifestyle change, weight loss, medicine, surgery, hepatitis treatment, diabetes control, abstinence, and all of this together, because that can only help bring us. So the last slide, I think it's important that many of us are senior citizens, and otherwise many of us have diabetes, many of us suffering from obesity. You must know your liver. Get screened if you have any of these issues, because like how we go for angiographies, and we are so particular now in India, people get angiography done even if they don't have any heart attack like of symptoms. but the focus on the liver is missing, and liver is as I said, used to be a one-way street. But fatty liver is often reversible. Even the inflammatory disease is now considered reversible with the modern medicines, and in some patients with metabolic surgery. And we can probably avoid liver failure and reduce the need for transplantation. So I think I wanted to highlight this, and I'll stop sharing this. I'll be very happy to take questions. This is not an area of my specialization, but I use these medicines every day on various patients, and I'm aware, so I'll be very happy to answer questions about semaglutide or about metabolic surgery. Thank you so much. Thank you, Madam President, and Ms. Ruby Agrawal for inviting me for this program. Thank you.
Thank you very much, Rotarian Dr. Ramen Goel, for enlightening us about the goal of GLP-1 as well as bariatric surgery in the liver diseases. Before I will open for everyone, I want a specific answer from you. If a patient is admitted and diagnosed for the liver transplant, the doctor says that you have to be your liver has to be transplanted, and they give time, okay, 3 months or so. Do you think this, either the medicine or the bariatric surgery, can still work at that stage?
So we do get patients who have been waiting for liver transplants, and because of their weight, they are not a candidate for surgery. So suppose somebody is 140 kgs and has a failed liver and has got a waiting for transplant. Many of the time, transplant surgeon says, please go and get a bariatric surgery done. You still have 6 months. You will lose 30, 35 kgs. You'll be a better candidate. You will survive the transplant better. So that is one situation where we do operate with all the risks that comes with a liver failed liver and of surgery. The other situation is that if this person has a let's say uncontrolled diabetes, or has suffering from severe obesity and gets a transplant somehow, the new liver is also likely to have the same fate. The new liver will also become fatty liver, or if the person continues to have alcohol, it will become alcoholic liver. So it's a good idea to intervene. So sometimes we have gone along with the liver transplant surgeon to do bariatric surgery simultaneously, or maybe 2 or 3 months later, so that the new liver, the transplanted liver, has a better lifespan. But it's entirely the transplant surgeon's call, because patient is struggling to survive. He decides whether patient has time to come to us or to take medicines.
My second question, before I am opening it, you mentioned about the medicine which is approved in USA, not in India. Do you think that medicine is far more effective than the GLP-1 what we are using in India, which has been approved only 8 days back in India? कब तक आप सोचते हैं कि वो मेडिसिन इंडिया में आ पाएगी? मैं हिंदी में थोड़ा इसलिए बोल रहा हूँ कि हमारे कुछ मेंबर्स ऐसे हैं जो चाहते हैं हिंदी में भी हम पूछें आपसे, तो क्योंकि आज भी सुबह भी मेरी एक गाजियाबाद में एक मेरे बचपन के फ्रेंड हैं, उनके लड़के को प्रॉब्लम है और वो एडमिट हैं, मतलब एडमिट नहीं हुए हैं अभी, उन्हें बताया गया लिवर ट्रांसप्लांट के लिए, एंड I suggested yes, that is the right thing. But when आपका जब प्रोग्राम फिक्स हुआ, जब पता चला कि इंडिया में अलाउ कर दिया गया है, तो उस वक्त मैंने आज उनसे स्पेशली कहा, एंड आई एम श्योर दैट ही इज वाचिंग और ही इज हियर ओनली, कि आप ज्वाइन करके पता करिए. तो उनका यही क्वेश्चन था कि उन्हें बता तो दिया है कि ट्रांसप्लांट होना है, और जो लड़के की वाइफ है उसका भी फैटी लीवर है, तो वो अपने लिवर को रिड्यूस कर रही हैं साइज के लिए. पर क्या आप सोचते हैं कि वो यूएस वाली जो इंजेक्शन है या मेडिसिन है उससे इम्पैक्ट आ सकता है, या बेरियाट्रिक सर्जरी से आ सकता है एट दिस स्टेज?
I can't answer that. It's very specific for a particular person. But these medicines, even the medicine that is not available in India, there is a government scheme where you can directly import the medicine for a patient-specific approval is given, and that the form is filled and the doctor signs it, and the medicine can be directly purchased overseas on a prescription. And so those medicines which do not have approval but have a FDA approval, so I mean, if somebody from that team or that patient's family is listening, they can probably talk to their transplant surgeon about this medicine, because this is a very specific based on the current situation, whether the transplant surgeon wants to wait, do not want to wait, is there a situation where this medicine can be used. Very difficult, it's a clinical judgment, and I can't really answer. But that medicine is definitely better than semaglutide, because that medicine work on a receptor in the liver. Semaglutide has no receptor in the liver. Semaglutide works indirectly by reducing weight, by controlling the diabetes, by many other factors together. But that medicine works on a thyroid receptor, alpha receptor, which is only available in liver. So it doesn't have any effect on weight. It doesn't have any effect on heart rate. Like if I give thyroid medicine to somebody, his heart rate goes up. But that is a specific to liver, and that's probably a game changer, if not for this patient, but for many thousands and millions of patients, if that medicine gets approved. The study is already going on in India. I'm aware of the companies who are doing it. So these are comparative studies. They generally take around 6 months to do it, and the approval another 6 months, the government requirements. So I think by mid 27 we should have that medicine available in India.
Okay, thank you very much. Now I'm opening it for everyone. Whosoever wants to ask, please unmute yourself, raise your hand. So then I think I have seen Rotarian Professor Dr. Sudhir Saran, who is at present in USA. Please ask your question.
Thank you. It was a very enlightening presentation, even if you say liver is, very complex organ we have. My first question is, when you were presenting in the last 3 slides, you said, if we take care of nutrition, it helps keep our liver healthy.
Right.
Now, nutrition is basically giving the macronutrients for energy and micronutrients for the biochemical elements that we need for the complex processes body has. Liver is a very important organ, because I know, I studied biology, that whatever goes in the stomach, if it is absorbed, the portal vein brings it to liver for further processing.
Absolutely.
Now, even if I eat very good things, my body, stomach and intestine do not absorb it, then liver can't do much for my health. And if I'm eating too much of sugar, but if I'm utilizing it also, then liver is not getting under stress. So I would like to understand from you what we as a modern people can do to solve this glucose problem. Even if we are taking excessively, are there ways so that our liver is blessing us, not cursing us? Can we do something?
Liver is a forgiving organ, so don't worry, it will not curse you. But the liver goes in trouble when you're doing it on a regular basis. So you have one meal a day, one meal in a week, or one meal in a month where you are eating excessive sugar or having a lot of alcohol. Liver will not bother. But if you are doing it on an everyday basis and every meal basis, then it's a trouble. Because as you rightly said, whatever we eat, everything passes through liver. Everything doesn't pass through kidney, everything doesn't pass through heart, but everything first goes to liver. Liver decides what will go in the blood all over the body. So what will go to every cell in the body. So liver is the master organ to process food. Now, the difficult part is what you asked about absorption, that how much will be absorbed. Nobody really knows. if I have a 10,000 calorie meal, whether I will absorb 10,000 calories or whether I'll absorb 500 calories, nobody really knows. But it's a continued insult, which is a more of a problem than once in a while situation. And generally, this is now as far as macronutrients or micronutrients are concerned, most of us, most of the educated class now knows about insulin resistance, about proteins, about simple carbohydrate, complex carbohydrate. It's not about doctors alone knowing it. Practically the whole society knows. And that's why, I was eating curd today evening and it was 29 gram proteins on one bucket of protein. So now that is happening in Starbucks also. They are having protein in extra proteins you can add over a coffee and all those things. So I think awareness level has gone through the roof, and that's a great thing to happen. Now, only thing is we need to implement this. We know everything, like how a smoker knows that smoking causes cancer, but still people smoke. Same thing is, if we know that alcohol causes problem, I'm not saying give it up completely, but at least moderate the consumption or make it once a week or twice a week. But if you're trying to do it every day in large quantity, you're inviting trouble. Or if you're eating simple carbohydrate in every meal in large quantities, then you are inviting trouble. So I think uh, let's not bother much about liver if we are maintaining ourselves healthy. If your weight is normal, if you're non-diabetic, or even if you're diabetic, your sugars are well controlled, liver will take care of itself. We don't need to worry about liver. But getting it screened early, and the screening is very simple. When we do a health checkup, most of us get it done at least once a year nowadays. Liver enzymes, but liver enzymes go up only very late. So it's a good idea to do an ultrasound of liver. If on ultrasound you have a fatty liver and liver enzymes are normal, change your diet to make it healthier. But if liver enzymes are going up, then you do other scan like a fibro scan kind of thing to see how bad is the liver disease. So I think it's a more of a clinical thing. As it's aggravated, we see it. But overall, eating healthy, having enough micronutrients like calcium, B12 or D3, we all know it. A lot of people I know take them routinely, as even though they are healthy, they still take it and try to maintain it well. I think that's the way to go. But people who are suffering from liver disease, this information should spread. That help is available. They cannot, because a lot of people in peripheral part of India, even doctors are not aware that these medicines are available. As Mr. Goel just said, it got approved 8 days back. So, and a lot of people travel worldwide. You are in US at the moment. So if they want, they can bring medicine from there and they can use, or the import policy allows us for an individual patient to import medicine in India, even if it's not approved. So I think all that information can save lives.
Okay, thank you very much.
Thank you. Thank you.
I can see the hand of Rotarian Professor Dr. Lakshmi Goel up. Yes, Rotarian Professor Dr. Lakshmi Goel, please unmute yourself.
Good afternoon. Thank you. Thank you for an excellent presentation. I really liked your visuals. The slides were very, very clean and easy to follow. I apologize for not having my camera on. I'm on the road, so it's going to be just audio. I had a question about, and maybe this is a very naive question, but in the cases where GLP-1 medicines do help in reversing the deterioration of the liver, why do you say that it is still a lifelong thing once you start GLPs? Can you not use them and get to a stage where things are fine and then stop taking them?
So, whatever we talk is based on the research data. Ultimately, science is only statistics. So we have analyzed that if you stop medicine, the people start gaining back weight. Their diabetes control goes away, and all the cardiomet. So a study got published by Oxford Group very recently, about 3 months back, where they pulled up all data from all over the world, and they have come out with conclusions, very clear conclusions, that if you stop taking these medicines within 1 year and 4 months, the cardiometabolic benefits get reversed, and the weight benefit gets reversed in 1 year and 7 months. So, this has to be taken lifelong. And another study got published, actually a pre-study, very recently from, I think, Preston, or where they have shown that if you stop medicine and stop and start, the effectiveness of the medicine goes away. So I think at the moment, the knowledge that we have says that you have to take it long term to have benefit of this.
Okay.
Thank you.
Thank you very much. Yes, I can see the hand of Rotarian PHF, Dr. Rohan S. Moniz.
Thank you, Dr. Goel. It was a beautiful presentation. Now, when we talk about reversal of liver conditions, especially fibrosis or fatty liver, what is your take on nutraceuticals? One, and secondly, they talked about black coffee without sugar, because that's the new beverage which is hitting all the coffee shops right now, and many people are on that beverage right now. So your take on that? Thank you.
Black coffee has been my staple for a long time. So I'm happy that liver surgeons are talking about it now, 2 cups a day. And so I go with that because, I accept anything that comes from science. So if that says black coffee is good, I'll take that. And nutraceuticals, in the sense that whatever are deficiencies, what are possible deficiencies, we must rectify that. So if you are talking of vitamins and minerals, I think it's essential that we not only see the normal reports. Nowadays we talk of optimal reports. So just for example's sake, I'll tell you, like, vitamin D is generally, in your published reports in the laboratory, says up to 30 is normal, while we prefer to maintain it around 55 to 60. Now that gives an optimal outlook. We see ferritin levels which the lower limit, normal limit is like 100, and I would like to keep it around 250, because there is the new knowledge coming on these micronutrients, that it's not about, like, iron is not only important for hemoglobin, that's also important for intracellular functions and the energy level of the person. So I think it's a good idea. I completely agree. The artificial intelligence, I also use it, is there to help, and we can read the reports. But it's always a good idea to go to a doctor and show the reports, because what you see as normal report may not be the best report for you. So I think nutraceuticals are very important, but which one are you taking and in what dose you are taking is also equally important. One thing, Dr. Moniz, because Dr. Lakshmi mentioned about the slides. Today, somebody suggested to me, it's out of topic, that Notebook LM is a great tool to chase the videos in PowerPoint. So this presentation, first time in the evening, I put it on Notebook LM, and it became some wonderful, very, very jazzy kind of presentation. If I show you, you will be so impressed. But I realized that this is not my presentation. This looks so artificial. And so I still went ahead with my presentation. But yeah, so presentation wise, I'm happy with the clean and neat lines. Yeah, thank you so much. Thanks for asking this question.
Thank you, sir.
Thank you very much. I can see the hand of Rotarian Deepan Shah again from USA. Yes, Rotarian Deepan Shah. Yes, please unmute. Yeah. Yes, go ahead. No, you are muted again. Please unmute. You are always on road whenever you ask the questions, Rotarian Deepan Shah. Yes, now you are unmuted. Please ask the question.
Oh, thanks. Yes, thanks, Mr. Goel, and all fellow Rotarians. मैं आपका शुक्रिया अदा करता हूँ. थोड़ा हिंदी में भी बोलने का ट्राई करता हूँ. आज तो मुझे वंडरफुल आपका प्रेजेंटेशन था, गोयल साहब, डॉक्टर गोयल साहब. सो आजकल मैं यहाँ ट्रेंड देख रहा हूँ कि bariatric surgery like sleeve gastrectomy or gastric bypass. Now जो glucagon like peptide 1 मेडिसिन जो मार्केट में अभी आ गई है, सो उसका सर्जरी का रेशियो बहुत कम हो गया है. अगर किसी को सर्जरी करानी है, बेरियाट्रिक सर्जरी, तो हाउ वी चूज और हाउ यू चूज स्लीव गैस्ट्रेक्टोमी इज आइडियल और गैस्ट्रिक बाईपास इज आइडियल? सेकंड क्वेश्चन है, आजकल प्रोटीन का ट्रेंड बहुत चल रहा है दुनिया भर में, तो एक्स्ट्रा प्रोटीन, एक्सेस प्रोटीन का लीवर का क्या कॉन्ट्रा इंडिकेशन हो सकता है? और वेज प्रोटीन इज बेटर और नॉन वेज प्रोटीन इज बेटर? आई मीन प्लांट बेस्ड प्रोटीन. थैंक यू सो मच.
Excellent. I think all of them are such important questions, but briefly, between the bypass and sleeve, there is nothing much to choose. So in my practice, if somebody has acidity or reflux, I do a bypass. If somebody doesn't have that, I'll offer a sleeve. So in simple terms, result wise, कोई ज़्यादा डिफरेंस नहीं है स्लीव और बाईपास में, वेट लॉस पे और डायबिटीज कंट्रोल में, पर एसिडिटी और रिफ्लक्स एक मेजर क्राइटेरिया है मेरे प्रैक्टिस में, जिस पे हम डिसाइड करते हैं कि हम बाईपास करेंगे और स्लीव नहीं करेंगे. As far as excess protein is concerned, excess proteins are definitely not required. A body has a filtration mechanism. Dr. Saran ne bola tha how much it will be absorbed. So even if I take 100% protein, body doesn't absorb more than 40% proteins. तो मैं अगर मतलब 100 ग्राम प्रोटीन खाऊंगा तो 40 ग्राम एब्जॉर्ब करेगी, 60 ग्राम विल बी पास्ड ऑफ. बट ऑन टॉप ऑफ इट, it definitely is not good to have excess protein, so you can have 1 gram per kilogram of your weight, but that is upper limit. And especially in patients who have kidney problems, excess protein should not be advised at all. So I think excess protein is a single thing, must be criticized, must not be used, must not be consumed, unless there is a reason. If somebody is working out in a gym for 2 hours, doing strength training or bulking up muscles and need to have extra protein, that's a different situation. But that's hardly 1 or 2% of the population, so we cannot generalize that. And as far as plant and animal based, I do eat non-vegetarian, but I prefer plant-based proteins when I take protein supplements, because I find them easier on the gut. It's easy. There is less bloating, easy digestion, easy. So most of our patients, bariatric patients, not because they are vegetarian, but even non-vegetarian patients, they try both and they find plant-based proteins are better tolerated. But that's a matter of individual choice. Maybe non-vegetarians in US may be taking. Also, the quality of proteins that are available depends a lot more on that, how they are prepared. Tolerability is a big issue. People do not tolerate protein shakes easily. So if they are very good quality, some people tolerate it. But proteins are in wide variety now. Proteins are in chocolates, proteins are in curd, proteins are in kulfis in India. I don't know whether you get it, Mr. Shah, in US. Amul makes kulfi, which has proteins in it. Proteins are in soups. In US, you get proteins in cappuccinos. So the proteins are everywhere. You can choose and decide which one you tolerate, but definitely don't take excess protein. That's not desirable.
Thank you very much. Now, I have seen the Rotarian, our inspired president, Rotarian PHF, Ritika Gupta wants to ask question. Yes, please, go ahead.
Yes, thank you very much. I thought you had missed it. But good evening, everyone, and thank you, Dr. Goel, for such a informative session. So, my question was actually more of a follow-up question on the discussion that Rotarian Lakshmi Goel was having, wherein she talked about why the medicines need to be continued for life. And I just got me wondering that, there are repercussions that come with spacing or not consuming medicines like thyroid or BP or any such medicines regularly. So is it the same kind of effects that some person can expect if they discontinue having the GLP-1 medicine or something like that? Or it's still not researched enough to say?
No, it's like this. So what you are saying is, if somebody is having a tablet, semaglutide tablet, then they have to
Right.
space it with thyroid medicine. But they
Right.
don't need to space it if they are taking an injection of semaglutide. So that's because of the absorption. Both semaglutide tablet and thyroid tablet have to be taken empty stomach first thing in morning.
Okay.
So they compete with each other in terms of absorption. But
Hmm.
this is not a problem when we talk of injections. So, that is one part of it. And when they are taking these medicines, their requirement of diabetes medicine and blood pressure medicines goes down. But these are all lifelong diseases, whether it's diabetes, whether it's blood pressure, whether it's obesity or liver, as we are discussing.
Right.
You need to take medicines lifelong. So best thing is to avoid having these problems. If you are health conscious, eating well, exercising well, and doing right things, don't have this disease. Even if you have inherited, I can show you number of people who had very severe diabetes on both the parents, and they are, because of their healthy lifestyle, are able to avoid. So if you can avoid, that's the best thing. But if you can't avoid, please don't stop these medicines on your own, because these medicines are, one should not use that word wonder medicine or miracle medicines, but they are as important a discovery as insulin was in 1921. Insulin, when it was discovered, they got Nobel Prize. It has not happened with GLP-1, but ideally it should happen, because this is affecting so many people worldwide and in so many ways.
Okay.
Right. Thank you very much.
Thank you very much. Any other question anyone who wants to ask? Before I will hand over back to the secretary, I just want to say that you initially said that Rotary Club of Organ Donation can be redundant if transplants will stop. I pray for that. Yes, it should. But the condition in India is worst. You know the figures, as you have mentioned, about the liver only, kidneys more than that, and all other organs also. And we know that the lifestyle is changing. Although the Gen Z, which is now in the news also right now, they are very health conscious. Now, I want to know from you, have you come across with the Gen Z people, young generation? Because the feedback which I am getting कि जो Gen Z वाले लोग हैं, वो बहुत अपने को health conscious रहते हैं. उनका alcohol intake बहुत कम है, smoking बहुत कम है, अपना weight conscious रहते हैं, कैलोरी वगैरह अपना काउंट करते हैं. बट एक प्रॉब्लम जो उनमें सबसे ज्यादा देखी जा रही है वो है स्ट्रेस लेवल. वो बहुत ज्यादा है. Do you think that because of stress level, again, the liver or other organs will be affected, and then they have to take the medicines or go for the transplant? What you say about that?
A very general thing, but definitely they are more conscious. And the burnout is also more happening in them, because the kind of work culture that has been given. I don't want to cite that person who spoke about that we should be working on all the days, the L&T managing director. This is not what we should leave for our kids. They must have 4 or 5 working days, and they should take break for 2 days. And that's even worse than having alcohol or smoking. So I think healthy lifestyle doesn't mean only eating healthy or non-smoking. That also means getting adequate rest to your body, to your mind, spending time with the family. And that's where the Gen Z is probably going wrong. A good number of them, because of job compulsion. It's not their fault, it's our fault that we are forcing them to work long hours. So I think time has come that the corporate should work like governments, where you have a 4 days or 5 days and 5.5 days work, and you have LTC for where you can travel for 90 days or 45 days, whatever it is possible. So I think that's important, that corporate culture should change, that look at health of the nation, not only when they sit on Jantar Mantar, but otherwise also we should be looking seriously at where things are going wrong, and we should correct that.
Thank you very much. I think my role is over. So over to you, Legal Secretary, Rotarian Goel.
Thank you so much. And thank you so much, Dr. Ramen Goel, for giving us your valuable time and such beautiful insights for all our members. And hopefully, with all these medicines and new this thing, we wish and pray that nobody should have to undergo transplants and seek for organ donation. That's why our mission to call expert doctors like you to keep our organs healthy. And moving forward, I request our Inspire and past president, Rotarian PHF Ritika Gupta, to please give the vote of thanks.
Thank you very much. Good evening, everyone. On behalf of Rotary Club of Organ Donation International, I extend my heartfelt gratitude to our esteemed member and chief guest speaker of the day, Rotarian Dr. Ramen Goel. Thank you, Doctor, for your enlightening and thought-provoking talk on exploring new opportunities for reversing liver failure. Your presentation was not only highly informative, but also very practical and relatable. Your insights into the role of GLP-1 medication and their potential benefits, especially for patients in early stages of liver disease, offered us a fresh perspective on the exciting advances in the medical science. We are truly grateful for your time, expertise, and passion for improving patient care. I would like to extend my sincere thanks to our Charter President, our Regal President, Secretary, board members, and every member who joined us in such wonderful numbers this evening. Your enthusiastic participation and continued support are what make our club meetings meaningful and impactful. Once again, thank you for being a part of today's session. A very good night, everyone. Thank you.
Thank you so much, our IPP Rotarian PHF Ritika Gupta, for the vote of thanks, and thank you everybody. आप सभी का बहुत बहुत धन्यवाद आज की रोटरी मीटिंग अटेंड करने के लिए. Over to you, President. Adjourn the meeting.
Thank you.